Thank you, everyone. This is the Audit Subcommittee of the Legislative Commission, January 14, 2001. Welcome to this third meeting of the Audit Subcommittee, this interim. I want to thank the state agency representatives that are participating in the meeting today. Over the past several months, of course, I think we've become more accustomed to meeting in this virtual manner. Be sure to mute yourself and unmute yourself as needed for speaking. Mr. Crossman, will you call the roll?
Senator Brooks.
Here.
Senator Goycochea.
Here.
Assemblywoman Carlton.
Here.
Vice Chair Benitez Thompson.
Here. All right, we have a quorum and we can begin. We will be having two periods of public comment today, one at the beginning of the meeting and one at the end of the meeting. It is limited to 3 minutes per speaker. There are ways to engage should you decide to do so. You can call in, and that number is 669-900-6833, and then enter our meeting ID, which is 987-5699-5456, followed by the pound sign. You can also email comments to lcaudit@lcb.state.nevada.us, or you can mail comments in writing to the Audit Division at 401 South Carson Street, Carson City, Nevada, 89701. And you're also welcome to fax comments to 775-684-6435. As always, this meeting will be recorded and available on the legislature's website. At this time, we are going to go ahead and make ourselves available for public comment.
Thank you, Chair. The public line is open and working, and there are no callers at this time.
Thank you so much. We are going to go ahead and move into agenda item 3 then, which is approval of the minutes of the meeting that was held on September 3rd, 2020. If members have reviewed the minutes and have no consternation with them, I will accept a motion to approve the minutes.
So moved.
Seconded.
Oh, Madam Chair, I believe you're muted.
Thank you. I have a first from Assemblywoman Carlton and a second from Senator Goycochea. Mr. Crossman, if we can call the roll.
Senator Brooks.
Yes.
Senator Goycochea.
Yes.
Assemblywoman Carlton.
Yes.
Vice Chair Benitez Thompson.
Yes, motion passes. We'll move into agenda item 4, which is the presentation of the 6-month report, and we'll welcome Mr. Crossman to walk us through these reports.
Thank you, Vice Chair. For the record, Dan Crossman, Legislative Auditor. The 6-month reporting process was established in statute many years ago to help ensure that recommendations are implemented. The follow-up process begins with a corrective action plan prepared by the agencies that have been audited 60 working days after the report is made public. Statute then requires the Director of the Governor's Finance Office to submit a report to the Legislative Auditor 6 months after the plan of corrective action, indicating the implementation status of each recommendation. After we receive and review those 6-month reports, we continue to work with and monitor agencies on recommendations that are not fully implemented. Today we have 5 6-month reports to share with you. And with that, Vice Chair, I'll turn it back to you.
All right, thank you so much. So we are going to begin with the Department of Health and Human Services, Division of Welfare and Supportive Services. And we have Ms. Shannon Rydell, our Chief Deputy Legislative Auditor.
Good morning, Madam Chair. Members of the Audit Subcommittee, in February of 2020, we issued an audit report on the Division of Welfare and Supportive Services. The Office of Finance issued the 6-month report on November 12th, 2020, indicating that 4 recommendations were—
Ms. Rydell, I'm gonna see if broadcasting, if the sound is gonna be a quality for all members, and It's coming through as choppy on my end.
Do you want me to continue or wait?
Ms. Rydell, could you check in your microphone and on the bottom left, just make sure that your audio is turned up?
Yep. Is that better?
That is slightly better. Thank you so much. Go ahead.
Okay. Let's see. So the Office of Finance, they issued the 6-month report on November 12th of 2020, indicating that 4 recommendations were fully implemented, 1 partially, and 3 had no action taken. The partially implemented and no action recommendations relate to using quarterly wage information between eligibility determinations, eliminating low-value notifications, addressing case notifications timely, and analyzing investigation and overpayment claims. So the 6-month report indicated that implementation of the recommendations was impacted by the pandemic, and that work on implementing remaining recommendations would not occur until after pandemic restrictions had been lifted. Our question to the division is, considering that the pandemic is ongoing, how much time after actions have been lifted does the division estimate it will need to begin implementing these remaining recommendations? And I believe there were a few people from welfare on the line, if one of them wants to answer that.
If we have someone from the Division of Welfare Services present?
Good morning. This is Lisa Swearingen. Can you hear me?
Yes, we can.
Thank you. So for the record, this is Lisa Swearingen. I am the Chief of Eligibility and Payments with the Division of Welfare and Supportive Services. For the findings 1, 3, and 4, Administrator Fisher testified back in February of 2020, stating that our agency would look for opportunities that may exist for real-time wage and employment data, so our staff could take immediate action on cases versus having to wait the 3 or 4 months with the quarterly data that we were receiving from DETR. We released an RFP for eligibility verification, a solution back in January of 2020, and a subsequent best and final offer in April. Unfortunately, due to the pandemic, we were unable to complete the process until November. However, I am excited to state that we have selected Public Consulting Group and their IEVS system as our solution. This solution will provide our staff real-time access to over 24 data sources. We held a kickoff meeting to work with PCG on January 6th of 2021. Planning meetings are currently being scheduled with development, testing, and implementation to follow. It is anticipated that the audit findings will be satisfied in a staggered manner throughout 2021, with a detailed project management timeline being available in the division's next month's 6-month report. With that, I'd be happy to answer any additional questions you may have.
Thank you so much. Staff, did you have any questions to ask directly of Ms. Swearingen before I open it up to committee members? Ms. Rydell?
I don't have any questions.
Okay. All right, at this time, I'll open it up for any questions from subcommittee members. All right. I do not believe I see any. I will say that it is very reassuring, Ms. Swearingen, to hear that although the COVID caused a delay in the process, that the department is moving ahead with the process and securing a data source to help verify these numbers. With where we are right now and the formal report we have, we know that we have 3 of the recommendations that I won't say no action because it sounds like there's some action, but actions in process. So we will go ahead and ask you back at a future meeting just so we can hear how the rest of these implementations on these recommendations are going. But it sounds like you folks are absolutely moving in the right direction, and we'll get lots of information from you folks regarding these recommendations at our next meeting.
I can say for the record, again, Lisa Swearingen, I do want to say thank you. We're very excited and we do anticipate being able to meet all of those in a very short period. So hoping to give you a very positive response at our next update.
Thank you so much. So at this point, I will go ahead and take a motion to approve the 6-month report.
So moved, Madam Chair.
I have a motion from us, Assemblywoman Carlton. I have a second from Senator Brooks. Thank you so much. I'll have Mr. Crossman call the roll.
Senator Brooks,
Yes.
Senator Goycochea,
Yes.
Assemblywoman Carlton,
Yes.
and Vice Chair Benitez Thompson.
Yes, motion passes. We're going to move into our next 6-month follow-up, which is State Department of Agriculture, Division of Consumer Equitability. And Ms. Rydell, it is yours again.
Okay. Is the sound okay? Okay. In February of 2020, we issued an audit report on the Division of Consumer Equitability of the State Department of Agriculture. The Office of Finance issued the 6-month report on November 12th of 2020, indicating 3 recommendations were fully implemented and 4 were partially implemented. The partially implemented recommendations relate to eliminating the backlog of inspections, establishing an equitable system of sanctions, developing certain policies and procedures, and determining whether a new system would be appropriate. We contacted the division in November of 2020 to discuss these recommendations. From that discussion, the division provided updated completion dates ranging from December of 2020 for the implementation of sanctions to July of 2021 for the full implementation of policies and procedures. Our questions relate to the division, related to whether the division has or still anticipates implementing these recommendations within those timeframes. And just for ease of this, I'll just ask them both questions at the same time. So when the department responds, if they could just respond to both, that would be great. Did the division implement a system of sanctions in December of 2020? And is the division still on track to implement the remaining 3 recommendations in February and July of 2021? And I believe there were a couple of representatives from the department, if they'd like to answer those questions.
Madam Chair, for the record, Cadence Matievich. I am the administrator of the Division of Consumer Equitability for the Department of Agriculture. And with your permission, I'm prepared to answer those questions.
Please do.
Thank you, Madam Chair. In response to question number 1, yes. With Legislative Commission approval of LCB file number R08120 on December 28th, 2020, which established civil penalties for violation of the state's laws and regulations pertaining to advertisement of motor vehicle fuels and petroleum products, we now have a consistent set of penalties and sanctions established across the scope of our regulatory responsibilities. We are in the process of updating our SOPs and guidance documents for inspectors to include those newly established penalties from R08120 and expect to complete that by the end of this month. For question number 2, the answer is yes, with one caveat for recommendation number 2 regarding elimination of the backlog of inspections. Of the 47,090 licensed commercial weighing and measuring devices in the Silver State, 55% have been inspected within the last 12 months, and 93% have been inspected within the last 24 months. However, a number of the devices that are overdue for inspection are located in businesses that are still temporarily closed due to COVID. If the owner or operator of that device has paid their annual license fee, we will keep their license active in our system. If those locations are not reopened by July, the devices will likely remain uninspected at that time. And additionally, depending upon the duration of the current statewide pause, inspection of devices in certain indoor retail locations may be deferred until after July. That concludes my response, and I'd be pleased to try to answer any questions. Thank you.
Thank you so much, Ms. Matievich. Questions from subcommittee members for Ms. Matievich?
Madam Chair, I have just a curiosity type question, if I could, for just a moment. So, Ms.
Yes.
Matievich, during the height of the pandemic, when I had to get gas, sometimes the actual store was closed, but the pumps were still working. So did you run into any issues with that? I mean, I know you can't do inspections, but we're not sure about the accuracy of those pumps. Was there any discussion around how they were half open, half closed?
Yes, for the record, Cadence Matievich, Department of Agriculture, Madam Vice Chair, through you to Assemblywoman Carlton. If the pump is open and operational, in most cases, we can perform at least a limited inspection. Typically, we do need an attendant there to help activate the pump. But in certain cases, we would go ahead and actually make a purchase of the fuel in order to verify the accuracy of the pump, and particularly in any case where we had received a complaint from consumer, we would certainly act in that fashion. I'm pleased to say that in most cases, very few locations now where gas stations don't have an attendant. Outside and outdoor inspections are among the lowest risk for us, and so with respect to retail motor fuel devices, we're actually doing quite well on those inspections, and have had our inspectors focused on those outdoor inspections in the early days of the pandemic and continuing today.
Okay. Thank you very much. Thank you, Madam Chair.
Thank you. And I appreciate that information being on the record that you folks were still able to get out there, purchase it, test it, and really were able still to respond to consumer complaints. I do not believe that I see any additional questions from committee members. And so I will go ahead and take a motion to approve the 6-month report.
So moved, Madam Chair.
Thank you, Assemblywoman Carlton, and a second from
Second.
Senator Brooks. Thank you so much. And Mr. Crossman, I'll let you call roll.
Senator Brooks,
Yes.
Senator Goycochea,
Yes.
Assemblywoman Carlton,
Yes. Good.
Vice Chair Benitez Thompson.
Yes, and motion passes. We'll go into the next 6-month follow-up, Department of Administration Fleet Services Division. And Ms. Rydell, the floor is yours once again.
Okay, the last one here is, again, we issued the Fleet Services Division report in February of 2020. And again, the 6-month report was provided to us on November 12th of 2020. And that report indicated that the Office of Finance was unable to confirm the status of all 7 recommendations for Fleet Services. Prior communications from Fleet Services indicated progress on implementation of the recommendations had been made. So we contacted Fleet Services and requested and reviewed necessary documentation in November of 2020 to determine the extent of progress made and determine the status of the recommendations. Based on this review, we believe the division has fully implemented all recommendations and we do not have any questions. However, we want to emphasize to the division the importance of sustaining the implementation of these recommendations, since most of the recommendations made in our report of February 2020 were from prior reports. So that concludes my presentation regarding the 6-month reports. I don't know if you have any questions for the Division of Fleet Services, but I do believe a representative from the division is on the meeting.
Okay, thank you so much, Ms. Rydell. So we have mostly fully implemented, but just the last sentence here that does state that a lot of these were kind of repeat findings from the previous audit. So that due diligence by the department to continue these practices will be helpful the next time there's an audit. Any comments for the record from Fleet Services Division?
Madam Vice Chair, this is Robbie Burgess, the Administrator for the Fleet Service Division. I do not have any comments at this moment.
Okay, thank you, Mr. Burgess. Audit Committee members, any questions for Mr. Burgess? Okay. Seeing none. Thank you so much for your time, Mr. Burgess. And I will accept a motion to approve this 6-month report. I see a motion coming in from Assemblywoman Carlton, and I see a second from Senator Gokachia. Thank you so much. And Mr. Crossman, I'll let you call roll.
Senator Brooks,
Yes.
Senator Goycochea,
Yes.
Assemblywoman Carlton,
Yes.
Vice Chair Benitez Thompson.
Yes, and motion passes. We will go into our next 6-month follow-up, which is the Public Employee Benefit Program Information Security. And we have our auditor, Shirley Itel Bingham. And it is yours, Miss Itel Bingham.
Good morning. Can you hear me, Vice Chair?
Perfectly, thank you.
Great. Good morning, Vice Chair Benitez Thompson, members of the Audit Subcommittee. For the record, I am Shirley Itel Bingham, Deputy Legislative Auditor. In February 2020, we issued an audit report on the Public Employees Benefit Program, Information Security. The 6-month report prepared by the Office of Finance indicated 11 recommendations were fully implemented and 3 recommendations were partially implemented. In November 2020, we contacted PEB management and reviewed relevant documentation. Our review indicated PEB has now fully implemented recommendation number 5. However, PEB indicates the business continuity plan review and the recovery process updates will be completed when the Chief Information Officer position at PEB is filled. PEB anticipates full implementation of these 2 recommendations in January 2021. Our questions for agency staff are, has a review of the business continuity plan been conducted? And number 2, has the agency completed updates to existing policies and procedures to define scheduling, testing, and documenting of the recovery process?
Great, thank you. And I believe we have Miss Rich present. Or Miss, yes, hello. You can go ahead and respond.
For the record, Laura Rich, I'm the Executive Officer of the Public Employees Benefits Program. Actually, today I would like to bring in Steve Martin, who is our new Chief Information Officer, to address these questions directly. So Steve, I think you're on, ready to go?
Welcome, Mr. Martin.
Yes.
You can go ahead and begin your comment.
Yes, thank you, Madam Chair. Stephen Martin, for the record, Public Employee Benefit Program Chief Information Officer, and I am prepared to answer those questions.
Would you like the questions resubmitted for or restated for you, or if not, you can go ahead and just begin your response.
Thank you. Yes, I have the questions. So
Okay, go ahead.
I did join the agency at the end of last year, and I have had a chance to review these audit findings as well as our response. And these last 2 items, items 13 and 14, which are relative to the disaster recovery and business continuity plan. We do have a draft, and we have not yet fully reviewed it and implemented it. We started that draft. We do anticipate completing that this month, January 2021. And to answer the second question, we have not yet integrated it into our policies as it is still in draft and is still pending final review.
Okay, thank you. Ms. Itel Bingham, did you want any additional information from Mr. Martin on that response, or are you satisfied? You're satisfied?
I think I'm satisfied, yes.
Thank you so much. If you want to move on to the second question, Mr. Martin.
Yes, I actually integrated both of my responses in there, but in short, the second question I believe was, have we had a chance to implement into our policies the rest of the business continuity disaster recovery plan? And the answer to that is not yet. We are working on the rest of our agency policies, for which drafts have been submitted and are currently under review and will be implemented this month.
Okay. Implementation by the end of the month. Thank you. Subcommittee members, if you have questions for Mr. Martin. Okay. Seeing none, thank you so much, Mr. Martin. I had not, I know that the auditors, you'll be following up on this one. I know that on the first review report that we heard, that specifically made a note that, we would have Division of Welfare Services come back just because they were in the process of implementation. It sounds like the implementation on this PEB information security plan is going to be in place by the end of this month. So I'll look forward to those reports coming back to the committee about how that implementation looks, and knowing that we've got this important information all secured. With that being said, Mr. Crossman will go, I'll take a motion to accept this 6-month follow-up report.
So moved.
Thank you, Assemblywoman Carlton, seconded by.
Second.
Thank you so much, Mr. Brooks. And Mr. Crossman, you may call roll.
Senator Brooks.
Yes.
Senator Goycochea.
Yes.
Assemblywoman Carlton.
Yes.
Vice Chair Benitez Thompson.
Yes. Motion accepted. Motion passes. We will move in to the last of the follow-up ones, the Office of the Governor, Nevada Office of Western Interstate Commission for Higher Education, and we have Deputy Legislative Auditor Amanda Barlow to present.
Good morning. For the record, Amanda Barlow, Deputy Legislative Auditor. In February 2020, we issued an audit report for the Nevada Western Interstate Commission for Higher Education. The 6-month report prepared by the Office of Finance indicated that 2 recommendations were fully implemented, and 8 recommendations remain partially implemented. The recommendations include developing or revising policies and procedures, developing a program tracking tool, and monitoring data accuracy. We contacted the office in January 2021 regarding the status of the partially implemented recommendations. Our question for the agency is, since the agency does not expect full implementation until September 2021, how does the agency anticipate meeting the implementation dates in the 6-month report?
And we have Ms. Alouette, President from Wichita, and so you're welcome to go ahead and give your response.
Yes, thank you. This is Jennifer Alouette, Director for the Nevada Governor's Office of Wichita, for the record. And unfortunately, the answer to this is just very more slowly than desired. We have 1 staff member right now, which is myself, and have had 1 staff member, myself, for the last year now. And due to the pandemic, we're unable to get in even temporary help because we don't have features in the office for social distancing. So we have been making a lot of progress. We had 215 open accounts. We've closed 80 over the last year, and we still have about 50 to go through. So it's just as I juggle that through my other duties, it's just taking a little bit of time, and then we need to revise our policies and procedures. We'll probably just do a full revision and create a new policy and procedure manual. So the answer is it will get done just a little bit slower than anticipated or desired.
Okay, thank you so much for that. We know when you're a one-man band, things take longer, and that there was, quite a bit of turnover before you came into the office. So we're appreciative of the fact that you're staying put, staying planted, and doing this work, because we're not going to get consistent policies if we just have so much turnover in staffing. So I appreciate that. I think then that it would make sense to have you, we'll have you back at the next audit meeting or potentially thereafter, and to kind of see how progress is going. Members of the committee, any questions for Ms. Owlett? Assemblywoman Carlton?
Oh, no, I was just getting ready.
Okay, all right. Okay,
It does look like they are moving forward, especially Senator Goycochea. Thank you, Madam Vice Chair. But especially along the lines of, with the state accounting system, and it does look like they're making some headway. So I appreciate that.
Yeah, thank you, Senator Goycochea. It was nice to see actually some collections starting to happen on these loans, on delinquent loans, because for a long time that work hadn't been done. So appreciate that as well. That being said, I will go ahead and accept a motion to accept the 6-month report.
So moved.
Thank you, Assemblywoman Carlton. A second from Senator Goycochea. And Mr. Crossman, if you can call roll.
Senator Brooks,
Yes.
Senator Goycochea,
Yes.
Assemblywoman Carlton,
Yes.
Vice Chair Benitez Thompson.
Yes, motion passes. All right, now we'll get into the new stuff. We'll go into agenda item 5, presentation of audit reports. Mr. Crossman, the floor is yours.
Thank you, Madam Vice Chair. For the record, Dan Crossman, Legislative Auditor. Under agenda item 5 today, we will have 3 performance audit reports. These have been maintained confidential with the exception of information provided to the agencies until now. Will be made public, obviously at this meeting, and available on our website immediately following our meetings today. Our first audit today under agenda item 5A is the audit delivery of treatment services for children with autism, which was performed as directed by the legislature, directed in Senate Bill 174 of last session. The audit was conducted by a team of auditors that included Jeff Mullen, Joe Abitan, Jennifer Otto, Sean Huser, and Shannon Rydell, along with the assistance of other members of our office and staff. I'd like to thank our staff as well as the agencies that we worked with on this audit to bring this together. A lot of work went into it, and we appreciate everyone's assistance. Today, Ms. Otto will be making our presentation, so I would turn the mic over to her at this point.
Thank you. Good morning, Vice Chair Benitez Thompson and members of the Audit Subcommittee. For the record, my name is Jennifer Otto, Deputy Legislative Auditor. As you will know, this audit was required by Senate Bill 174 of the 80th session of the Nevada Legislature in 2019. This bill is included in Appendix A of our report on page 42. If I could direct your attention to page 1, I will begin my presentation with background information. It is estimated that autism spectrum disorder, or ASD, impacts about 1 in every 54 children in the United States. While determining the number of children in Nevada with ASD is difficult, we use the Nevada Department of Education's count of children with autism as documented through an individualized educational program, or IEP. Autism-specific IEPs are developed for children exhibiting behavioral characteristics consistent with ASD in a public educational setting, but do not necessarily indicate a child has received a medical diagnosis of ASD. For the 2019-2020 school year, 9,075, or 1 in every 55 children, had an autism-specific IEP. Exhibit 1 provides the number of students in Nevada schools whose IEP indicated autism as the primary condition for the 2016 through 2020 school years. Pages 2 and 3 provides a definition for ASD, describes the diagnosis process, describes applied behavior analysis or ABA, and lists the types of ABA providers. Pages 4 and 5 gives an overview of the Autism Treatment Assistance Program, or ATAP, and its plan types, as well as the role of Nevada Medicaid in providing ABA services to children diagnosed with ASD. The audit scope and objectives are noted on page 6. Our objectives were to 1, determine if revenues and expenditures related to autism therapy were sufficient and appropriate. 2, evaluate and review whether children wait for services and if enough providers exist to serve Nevada's population of children with ASD. And 3, identify and assess factors that inhibit access to and delivery of autism treatment services. We conduct our audits in accordance with government auditing standards, and these standards require us to report any constraints imposed on the audit approach and limitations on access to information, which we discuss on pages 6 and 7 of the report. The limitation included inaccurate and counterclaim data received from Nevada Medicaid. However, we do not believe this limitation impacted our audit objectives or affected our conclusions because of other procedures performed. The methodology section of the report at Appendix G, which begins on page 52, provides further detail regarding the data obtained and assumptions made. Our findings and recommendations begin on page 8. We found that state agencies did not spend all funds budgeted for autism treatment. In the 2015 legislative session, the state estimated costs to provide autism treatment to be $35.7 million annually. This amount was projected to cover an estimated 2,500 children needing treatment services. However, since fiscal year 2017, only about $15 million per year on average has been spent on autism therapy services. Exhibit 2 on page 9 shows the expenditures related to autism services by program and children served over the last 5 years. For Medicaid, this occurred mostly because the number of children receiving services continues to be well below that estimated during the 2015 legislative session. As discussed on pages 10 through 12, we also found that overall program expenditures for ATAP have been declining as ATAP has transitioned qualifying children to Medicaid. On pages 12 through 15, we discuss our findings related to fee-for-service Medicaid claims, which were unreasonable and possibly fraudulent claims that were paid. Specifically, too many hours were charged for a single day. Our review of Medicaid fee-for-service claim data showed providers billed and were paid for 15 or more service hours in a single day on over 3,000 occasions since 2016. Claims totaled $3.9 million, with 56% of that paid to 4 provider groups. We also reviewed fee-for-service claims for services provided to individual children and found 3,602 instances where the amounts billed exceeded 10 or more hours for a particular day. These claims totaled $2.2 million over the 5-year period. Claims, some of which may overlap between providers and children, totaled about $6 million since fiscal year 2016 for excessive service hours, but we could not calculate an overpayment because we could not determine what portion of each claim was legitimate, if any. Exhibits 5, 6, and 7 on pages 14 and 15 show details of the top 5 specific providers and specific dates that overbillings occurred. Appendix C, beginning on page 46, details all providers who billed and were paid excessive daily service hours. Exhibits 8 and 9 on page 16 show details of specific children receiving excessive services in a single day. The Medicaid system does not have adequate system controls, such as edit checks, to detect providers billing an unreasonable number of hours in a day for autism services. Additionally, there are few system controls to limit the number of service hours billed and paid in a single day. As required by NRS 218G, we reported this information to the governor, each legislator, and the attorney general. Appendix D on page 48 contains that letter. On page 17, we discuss our findings related to Nevada Medicaid not detecting inaccurate data provided by managed care organizations. Specifically, we found encounter data had the following problems. Claim information only included service time billed and not the service time paid. Data included medical procedures other than autism therapy when it should not have, and information provided directly by managed care organizations did not always agree to encounter claim information. These errors existed in Nevada Medicaid's information system because Nevada Medicaid is not reviewing encounter claim data submitted by managed care organizations for accuracy and appropriateness. Lastly, beginning on page 19, we discuss our analysis of the fiscal notes provided by Nevada Medicaid and ATAP, which overestimated the costs for a proposed rate increase for autism therapy services in Senate Bill 174. Agencies' estimates were based on unreasonable assumptions. These problems occurred because agencies did not have adequate controls to ensure information submitted is appropriate and used universal templates without considering program-specific factors when estimating the fiscal impact of proposed legislation. Exhibit 10 shows the agency's projected costs and our recalculated projected costs. Pages 20 and 21 contain 7 recommendations to improve internal controls and other fiscal matters. Our recommendations are the following. Nevada Medicaid should determine reasonable limits to the number of service hours in a one-day period for both providers and children. Nevada Medicaid should develop system edits to prevent claims with excessive service hours. Nevada Medicaid should further investigate claims with unreasonable service hours and identify and recover overpayments and refer potential fraud to the Office of the Attorney General. Nevada Medicaid should develop a process to routinely review and counterclaim data, including procedures to ensure data submitted is accurate and services provided to children are appropriate. ATAP should establish a process and additional controls to ensure reconciliations for insurance assistance plan payments are completed, accurate, and timely. ATAP should develop a centralized process to obtain and retain documentation from insurance assistance plan participants. ATAP and Medicaid should establish additional monitoring and review controls to ensure information submitted to the legislature is based on reasonable assumptions specific to the relevant program. Chapter 2 begins on page 22. We note that families frequently struggle to obtain timely services for their children with autism. Continue on page 24, we note that families generally lack support from state agencies prior to children obtaining an autism diagnosis. A lack of comprehensive information about programs, requirements, and step-by-step guidelines on the diagnosis and treatment process is a barrier for all families who suspect their child may have ASD. No agency or licensing body maintains a list of providers who diagnose ASD. Our survey of families revealed the extent of the difficulties faced by families concerning the process of getting a diagnosis for their children. 51 of 118, or 43% of families responding to our survey, indicated obtaining an ASD diagnosis for their child was either hard or very hard. Additionally, 72 of 118, or 61% of respondents to our survey, indicated they had to wait more than 4 months to obtain an ASD diagnosis for their child. Continue on page 25, we note that delays in getting services are a major challenge for parents seeking ABA treatment for their children. An ATAP June 2020 report noted the average time for children on the ATAP waitlist was 153 days. ATAP's wait time calculates the time from when a child has completed their ATAP application, which requires that they already have a diagnosis of ASD, to the date at which a provider accepts a child for future services. The wait time does not include any time that family waits to obtain a diagnosis, the time from a diagnosis to when a family completes an ATAP application, or the time from when a provider accepts a patient to the actual date of the first appointment. On page 27, we note families do not receive assistance in identifying and securing therapy providers once children receive a formal diagnosis. Limited capacity means children wait for openings in provider schedules, with placement dependent upon luck and caregiver tenacity. Furthermore, older children or those with more difficult behaviors may wait longer because providers can be selective and after-school service hours are highly coveted. On page 29, we have 5 recommendations for ATAP to assist families obtain timely treatment for their children. Our recommendations are the following. ATAP should develop and publish specific guidance regarding how to obtain a diagnosis and apply behavior analysis treatment for those inquiring about services. ATAP should create and maintain a list of healthcare professionals qualified and performing diagnoses of autism spectrum disorder. ATAP should assign care managers to families as soon as program eligibility is determined. ATAP should actively monitor provider availability and assist families in obtaining and selecting a suitable provider. ATAP should develop a standardized process to identify children with the greatest need for immediate placement with applied behavior analysis providers to expedite services. Chapter 3 begins on page 30. We found Nevada does not have a sufficient provider base to adequately provide ABA therapy to all children with autism who medically require services. Exhibit 13 on page 31 shows the growth in ABA providers based on licensing information only, which does not necessarily represent those providing services, as some may be licensed but leave the workforce. As of October 2020, Nevada has over 1,600 professionals licensed to provide ABA therapy. Appendix E on page 50 shows the number of licensed providers by location according to their licensee information. While the number of providers has increased in recent years, we estimate there are only enough providers to serve about 2 out of every 3 children who would most benefit from ABA services. Continuing on page 33, we found that the shortage of ABA providers for children with Medicaid is worse than for children with private insurance, since only about a third of licensed ABA providers served Medicaid children in fiscal year 2020. Consequently, children covered by Medicaid and ATAP programs wait for treatment to begin longer than children with private insurance. Registered behavior technicians, or RBTs, who deliver the majority of the one-on-one therapy are reimbursed half the rate by Medicaid and ATAP that private insurers pay. There are many factors that affect if a provider will treat a particular child, but provider groups indicated they consider reimbursement rates when filling openings. Continuing on page 34, we note that planned reductions to Medicaid rates would further reduce rates as a result of COVID-19 related budget cuts. Based on the much higher rate for private insurance reimbursement, providers have a greater monetary incentive to serve children with private insurance than those with Medicaid. Exhibit 16 on page 35 shows the Medicaid rate in comparison to the average rates paid by private insurers from our sample. We note that the Medicaid rate listed in the exhibit does not reflect the pending 6% rate cut that would be applied retroactively from August 2020 if approved by Centers for Medicare and Medicaid Services. Provider groups indicated Medicaid reimbursement rates do not cover all costs associated with employing RBTs. An increase in the RBT reimbursement rate would help Medicaid compete for a limited number of providers. On page 36, we submit to the legislature that as funding becomes available or when the legislature deems appropriate, the legislature may want to consider directing Nevada Medicaid to increase the reimbursement rate for RBTs to reflect more closely the rates paid by other insurance coverage entities in the state. Chapter 4 begins on page 38. While state and local agencies coordinate efforts to some extent, improved communication will enhance outcomes, ease transitions, and result in more robust delivery of services for families with children with autism. School districts can begin providing Medicaid reimbursable services, which allows children to receive ABA during the school day and also provides additional federal funds to help offset the costs. On page 39, we note that 9 school districts plan to bill Medicaid for autism therapy provided by or through the school. Some therapy will be provided by school district staff, while others will be provided through outside contractors. 8 school districts currently do not plan to bill Medicaid for autism therapy. Appendix F on page 51 displays specific school district participation in billing Medicaid for ABA services during the school day. The decision to participate in ABA programs is unique to each school district, which must weigh various factors in deciding whether ABA or other ASD therapy is in the best interest of their students and the district. On page 40, we note the additional coordination is needed between Nevada Medicaid and ATAP. While ATAP actively case manages the majority of Medicaid fee-for-service participants, on average about 14% did not receive case management services. Case management helps parents and children navigate provider and program policies, understand services provided, and assist families in obtaining the most appropriate services for each child. Since case management can be billed to Medicaid, ATAP can also receive additional revenue to offset costs associated with providing these services. Page 41 contains 2 recommendations to improve communication between agencies to better serve the population of children with ASD. Our recommendations are the following. Nevada Medicaid should continue working with the Nevada Department of Education and Nevada school districts on the implementation of the state plan amendment for school districts to receive Medicaid reimbursement for applied behavior analysis services. Nevada Medicaid should provide ATAP with contact information for new enrollees so ATAP can offer targeted case management to families. Appendix B begins on page 43. It is an acronym list and glossary. Our audit methodology begins on page 52. Appendices H and I, which begin on pages 59 and 63, contain the responses from Nevada Medicaid and the Aging Disability Services Division. All 14 recommendations were accepted. Vice Chair Benitez Thompson and committee members, this concludes my presentation. I'd be happy to answer any questions.
Thank you so much, Ms. Otto. At this time, we will go ahead and invite up representatives from the 2 different agencies in order to offer remarks, and then Actually, no, at this time, we'll first start with if subcommittee members have questions for Ms. Otto, not the agency, but for our auditor on any information in the audit.
Yes, Madam Chair, may I ask a question?
Please do.
Thank you. And just to make sure that I'm understanding, when I'm looking at page 46, Appendix C, it says provider 1, 2, 3. When we use the word provider, is that a group of providers, or is that one single person?
That was one single person.
So under provider 3, the net payment was over $1 million, over 9,000 service hours, and an hourly rate of $110 for one person?
For one person since 2016.
Since 2016?
Yes.
Okay, so that's 16 to 20.
Yes.
So as you were looking at these, we've had this issue before in another area, and part of it we found was fraud, and part of it we found was just confusion in recording the hours. Can you opine on what you found?
We gathered that information from the claim data, so the agency would probably be better equipped to answer that question as far as how they monitor that specific providers are entering that claim data correctly. But the claim data is what was paid through Nevada Medicaid.
Okay, I'll save they've just got a heads up on what question is going to be coming, so thank you. Madam Chair.
Thank you so much. Other committee members? I did have a question, Ms. Otto. So the ABA services can be provided by 3 different licensing types, ranging from the RBT, who just has a high school diploma and then 40 hours of training, all the way up to the board certified behavioral analysis, who has a master's degree and then 700 hours of supervision and then 15 hours of independent supervised field work. So quite a range there. Did you, among those licensing types, did we notice a difference in any of the billing discrepancies? Or did they seem to be across all licensing types kind of equally?
Right. Yes, across all licensing types.
Okay. And then also across the different licensing types. Well, I guess it would be that the next question I have is probably going to be one for the department. That was the only one that I had specific to the data in the audit.
Vice Chair, this is Shannon Rydell, Chief Deputy Legislative Auditor. If I could just provide a little bit of clarity regarding this. So Assemblywoman Carlton, you had some questions on page 46 and 47, and those are individual providers, but those individual providers are billed through provider groups. So I think in this instance, we found that a lot of the individual providers came from same provider groups. And so I don't know if that provides some clarity regarding your question and also relates partially to what Vice Chair Benitez Thompson was kind of asking as well.
Thank you very much.
Yeah, so Ms. Rydell, I guess those provider groups, while we're not necessarily talking about the names of those 4 specific provider groups, those provider groups had the 3 different licensing types, or were those provider groups mostly comprised of one kind of licensing type?
I believe the provider groups, they have to have a BCBA to oversee the RBTs. So most of the provider groups will have to have multiple licensing types associated with them to provide the services for ABA therapy.
Okay, all right, thank you so much. Okay, seeing no other questions from committee members at this time for our auditors, we'll go ahead and invite up representatives from our two different agencies, Medicaid Finance and Aging and Disability. And I think I have four individuals who are present from Medicaid Financing, and then 3 who are present from Aging and Disability Services. And so why don't we go ahead and start with folks from Medicaid Financing, and I think I've Ms. Bierman, Ms. Finney, Mr. Young, and Mr. Burrell. Is that right?
Morning. Yes, thank you.
Good morning. Okay, so I guess I'll let you go ahead and start with just comments and responses, and then open it up to members for questions.
Well, thank you. Suzanne Bierman, for the record, Administrator of the Division of Healthcare Financing and Policy. Did want to highlight that we have accepted all of the recommendations provided in this audit. Always appreciate the opportunity to continually improve our program, and have already started digging in, looking at these issues in greater detail. Certainly already have some process improvements in place, and we'll continue to be working to improve our processes and further research the issues that have been raised today. Do have all 3 of the deputies from Medicaid on as well. Some of these issues get pretty technical. So we have Deputy Administrators Cody Finney, Dwayne Young, and Phil Burrell. But again, just did want to highlight that we have accepted all of these, are working on plans to further research and address these over the course of this period and throughout. We certainly take program integrity concerns very seriously and want to make sure that we're being good stewards of taxpayer dollars. So this is something that our surveillance, utilization, and review unit is currently digging into, and we do currently work closely with the Office of the Attorney General and their Medicaid Fraud and Control Unit. So have been in contact with them and are working on further investigating the issues raised in this report. So with that, we'd be happy to address any specific questions that committee members have.
Okay, members, questions?
Madam Chair, if I may.
Please.
Along the same lines of the question that I asked earlier, in looking at this and evaluating it, you glanced along the fraud side, but is there an issue on the reporting side that causes a problem? We had this once before, and part of it was reporting. So is there an issue with how the reports are filed and then aggregated together? Can you just expand on that?
Yes, thank you for the question, Assemblywoman Carlton. I do think that there are probably some issues related to data reporting, and we're currently looking into those. Did want to highlight some process improvements the division already has in place since the time this audit began. Certainly one of the biggest projects that we've undertaken recently is the modernization of the state's Medicaid management information system. And that's kind of been finalized over the last 2 years, implemented in 2019 with final certification activities just wrapping up. So that's been a large undertaking in the way that we process claims, and have updated some of our processes around encounter claims as a part of that effort. We've recently established an encounter work group to look at this data in April 2020, are also working closely with the managed care organizations to make sure that we all stay on the same page around edits, data quality, and monitoring processes. So have started establishing that work group. I think that will help address some of these issues and make sure that defects are being identified. We have identified one defect recently. I don't know how technical you guys want to get on this. I know some of it is pretty in the weeds, but we did have one defect with a duplicate edit, and we have since implemented a fix on that, which has improved our data quality around encounter claims that have been submitted. So just wanted to highlight that we've also raised autism services to the top of the list of issues for this work group to address. So that monitoring began in January 2021, and there will be monthly reports being provided specific to these ABA services. So there is a lot going on in terms of our reporting and data and the modernization of the MMIS and some new work groups that we've been convening and working with our managed care partners to make sure that all of these issues are being identified and solutions identified and implemented for any defects that we find along the way. But I do think to your other question, and maybe Deputy Administrator Cody Finney can provide some additional detail on this piece. We are looking into this with our surveillance utilization and review unit. I think once they have a deeper dive, we might have a more specific answer to your question. Right now, I think we're trying to go through and see what is appropriate for those types of referrals and what might be accounted for by other just ways we count days and the way that we pay claims.
Okay, thank you.
Thanks.
Other committee members?
Madam Vice Chair, I'm really not up to speed on this as much as I probably should be, but I'm concerned are we also going to look at, if we've got the professional at $120 an hour and then more of a layperson, I'm going to say at $30 an hour, are we also going to look at, the level of treatment and the level of benefit and the differences between those two billing rates? Did that make any sense to you? I'm just concerned if, okay, we're charging all these guys, if we've got the professional level at $120 an hour, it's kind of like, okay, can we pay a vet tech, which in my world, can they do the job adequately and not have to pay the $200 vet rate?
Suzanne Bierman. I apologize, Senator. I thought you were done. I certainly didn't mean to interrupt. I was just trying to find a time to jump in. Okay.
You're fine. I was just wondering if you were going to look at that as well, the level of service you get for the dollar.
Absolutely. We certainly review service utilization and want to make sure that we're providing services at the adequate level of care. So we'll absolutely be taking a look at that as well.
Madam Vice Chair.
So, Ms. Bierman, then, as you are rolling out the new Medicaid system the information tracking system that's going to allow us to be kind of more accurate on provider claims submitted and versus what we pay, do you expect that will address the problem of excessive hours completely, or do you imagine that will give you a starting point in terms of how a process would need to be changed and then expect additional work to be done?
So, thank you for the question, Vice Chair Benitez Thompson. I think part of that is if we add additional edits to our system, some of that will be addressed automatically. When those claims then hit the edits, they won't pay if we add new edits to the system, which is one of the recommendations. And we do have a team researching that potential option. So I think that there's certainly a piece there. And I think if general information around the process of the surveillance utilization and review unit would be helpful, or our general program integrity activities and how we allocate resources there, maybe Deputy Administrator Finney has additional information, but I'm not sure if the systematic piece of it was adequate and addressed your question, if you would like more info on how we organize our surveillance utilization and review processes and our program integrity efforts more broadly.
Well, I guess what I'm trying to get a feeling of is knowing that you're responding to the findings and you're working on it. I just was trying to set what would be a realistic expectation for saying that this problem is solved and these types of excessive billing. And because I imagine that it's shocking right now. I would imagine that within these community of providers, there's got to be a high level of anxiety knowing that almost a good vast majority of them might be, accused of Medicaid fraud for excessive billing in a day. And that if we are talking about changing that system, make sure that if there were errors versus people who are sending fraudulent billing, that we would be able to have that sorted out in 5 months, 6 months, or what we tell the public about how we're fixing this and how we make sure the parents in the community know. It's a little bit jumbled right now, but within a year from now, we should be in a place where this is no longer happening, or we're still in transition.
Thanks for the question, Vice Chair Benitez Thompson. I think definitely within the year we'll know, with further research into this issue and investigation into these particular findings, have a better sense of which of them have been moved on and found warranted to move up to the level of the Attorney General's Office and Medicaid Fraud Control Unit, what portion of them have reached that level. Again, once we look at the data more, how much might be explained just in terms of how the billing is occurring, and also whether or not any system edits have been put in place. And I think, the process of adding a system edit, I think could also be accomplished within a year. So I think we'll have more information for you certainly within a year, which of those passed, and more information about once we and the Attorney General's office dig into these specific claims, what level was found to, what percentage was found to rise to the level of being investigated further related to fraud, waste, and abuse, and what percentage was explained by service billing limits and the way our policy and system process claims.
Okay. Any additional questions coming from committee members for the Medicaid Healthcare Financing and Policy Group? Okay, seeing none, then we'll move on to aging and disability. And I believe we have Ms. Schmidt, Ms. Robb, and Ms. Jamie. Did I get that right?
Good afternoon. This is Dina Schmidt, Administrator for Aging and Disability Services Division. And yes, it's Samantha Jaime is with us. She is the Program Manager for our Autism Treatment Assistance Program. And Ricky Robb is our Deputy Administrator. So, and they're both available to answer any detailed questions. But I'll give you a broad overview. We have accepted all of the recommendations in the report. Regarding recommendations 5 and 6, we have already implemented a process for reconciling our explanations of benefits for our insurance assistance program, as well as a process for retaining that documentation. In regards to number 7, while fiscal notes included descriptions in the past of our fiscal assumptions, I think one of the things we missed was some of the programmatic assumptions made in our fiscal note analysis. So we will ensure to improve those going forward. In regards to recommendations 8, 9, and 11, I think these are all really aimed at improving information that's available to families regarding how to find providers, how to get a diagnosis. We've accepted these recommendations as indicated in our response, and we will be providing this type of information on a regular basis. The challenge will be is that this information changes on a regular basis, is that providers come in and out of groups, in and out of networks. So we will do our best to maintain that on a regular basis and get it updated. And I think the other thing to make note of is that, while the statute says that we serve children with a diagnosis, we recognize through this audit the challenges that many of these families are facing before they get the diagnosis. So we are accepting the recommendations, and we'll do what we can to support families while they are looking for obtaining services and diagnoses as well. In regards to recommendation number 10, this would require additional staff to accommodate it. Our current staffing ratios are for families receiving services and have never included staff to support those families on the wait list. However, we are developing a risk assessment tool that will help us identify factors and what other resources we could refer families to. So we will ensure that we are referring families to other community services, state agencies, anything that we can do to support those families while they're on the wait list. And then we would include a request in future bienniums for staffing to serve the wait list. And then recommendation number 12, also the risk assessment tool that I discussed, which is being developed, will help us standardize a process for identifying children with the greatest needs and in order to get them into service the soonest. That tool is being piloted right now, and we are hoping to have it finalized by the end of this month. So with that, I'm happy to answer any questions you may have.
Thank you. I appreciate that. Just a quick question on the last piece there about the risk assessment tool that you're developing, piloting. And so is this going to be something that you imagine that your case management staff would do, or do you imagine that this was something that the providers in the community would use?
Tina Schmidt, for the record, we would be doing it. Our intake team would be doing the assessment. That way, when families come to us for services, we have the ability to kind of prioritize those with the greatest need, as well as identifying other needs that we can, other places to refer them to and get them additional services to support them while they're waiting either for a diagnosis or a provider.
Thank you so much. And then the other question I had real quick was, you mentioned and you state that you are doing the enhanced request in the budget for increased staffing. And so is that something that we'll be seeing in the next couple weeks with agency budgets that's in there, that's baked in?
Tina Schmidt, for the record, while this recommendation came to us prior to the process for building our budgets, and until the governor's budget has been released, we won't know that, but we did not, this was not included as we were building our budget. We were not familiar with this recommendation, so we were looking at that for future bienniums in addressing. As we develop that caseload ratio, we'll have to look at that in a future biennium.
Thank you so much. Committee members, questions for Aging and Disability Division? Okay. I see none. So at this point, I will go ahead and accept a motion to approve the report.
So moved, Madam Chair.
A motion from Assemblywoman Carlton, a second from Senator Brooks. Thank you so much. And Mr. Crossman, I'll let you call roll.
Senator Brooks.
Madam Chair.
Oops, sorry.
Madam Chair, just a quick comment before we do the roll call.
Oh, please.
Thank you. We're going to be in session very, very soon, and I think addressing some of these issues, even though we know we have a very tough session ahead, children can't wait that long when they have this. The sooner we get to them and the sooner we help them, the better off the families are and the kids. So we want to keep having these discussions through next session to make sure that we can get the information to the parents so that they know what they need to do. I understand the comment about next biennium and trying to address some things, but I think the more we can talk about this next legislative session to see what pieces of this we can fix, especially to get kids diagnosed, will benefit the children and the families greatly. So just wanted to put that on the record.
I appreciate that, Assemblywoman Carlton. When you think about how long we've been discussing this and trying to get it right, and there was a bill, and then we had to say, before we can do more with money, we just have to really understand what's happening. And we have that audit now and a lot of good information to direct us. So I appreciate those comments. Mr. Crossman, I'll let you call.
Senator Brooks.
Yes.
Senator Goycochea.
Yes.
Assemblywoman Carlton.
Yes.
Vice Chair Benitez Thompson.
Yes, motion passes and the audit is accepted. All right, we will now move into the Public Employees Benefit Program, Information Security Operating Software and Database Application Software Audit.
Thank you.
And we have Miss Itel Bingham presenting on this one.
Thank you. Vice Chair Benitez Thompson, members of the Audit Subcommittee, for the record, I am Shirley Itel Bingham, Deputy Legislative Auditor. This report addendum provides supplemental findings, conclusions, and recommendations from our performance audit of the Public Employees Benefit Program, Information Security, LA 2013. We issued that report on February 18th, 2020, and it contained 8 recommendations in regard to management of computers and network devices, 4 recommendations to strengthen user management, and 2 recommendations to complete security-related plans. An addendum to report LA 2013 was necessary because security vulnerabilities.
Melanie, that's Michael Scott on the phone? That's the guy that was kind of aggressive about chat.
Assemblywoman Carlton, I think you are off.
Nobody called him.
Or broadcasting, if you could, thank you.
Okay. An addendum to report LA 2013 was necessary because security vulnerabilities existed in certain information systems within the Public Employees Benefit Program. Providing details regarding those vulnerabilities at the time we published the original report would have unnecessarily exposed those information security weaknesses. On September 9th, 2019, a letter pursuant to SB 302 was issued to the Governor, Chair of the Legislative Commission, Chair of the Audit Subcommittee, and Head of the agency affected upon identifying our findings related to the vulnerable systems. Since the agency has performed sufficient corrective actions, we are issuing this report addendum as a supplement to the original report. Please turn with me to page 1 of the report addendum as we begin to discuss our audit findings. The findings of the audit relate to server software lacking critical security updates. Many of the agency's servers had critical security vulnerabilities due to outdated and unsupported software. The agency did not ensure that operating systems and database application software were upgraded to supported versions in a timely manner. Without proper software upgrade planning, PEB compromises security performance and overall efficiency. At the top of page 2, we note that PEB was also not conducting vulnerability scanning on its servers. PEB could have identified outdated software and security update issues earlier had they performed vulnerability scanning and maintained a software inventory. At the bottom of page 2, we note that PEB's Linux servers lacked oversight. Some of the agency's Linux servers were not adequately maintained. We determined the system administrator had not maintained adequate password documentation nor sufficient server documentation to ensure server maintenance was occurring. On page 3, we made 4 recommendations to correct weaknesses in the agency's information security controls and improve the security of the agency's servers. These recommendations will help ensure the agency has sufficient controls in place to prevent its servers software from becoming outdated, unmanaged, and unsupported. Beginning in February 2020, we conducted monthly meetings to obtain status reports and monitor the progress of the software upgrades. We continue to monitor PEB's progress until successful upgrading, patching, or decommissioning of all the servers was complete. Page 4 of our report discusses our audit methodology. The agency's response to our audit begins on page 6. The agency accepts all 4 of our audit recommendations. That concludes my audit presentation. I'm happy to answer any questions. Thank you.
Thank you so much. Questions from audit subcommittee members? Seeing none, I'm glad that we've got this work done. I'll go ahead and offer, I believe Ms. Rich is still on the line if you have any comments for the record.
Sure. So good morning, Vice Chair Benitez Thompson and members of the committee. I'm Laura Rich, Executive Officer for the Public Employees Benefits Program. I also have, as you heard earlier, Steve Martin, our new Chief Information Officer, with me to answer additional questions as well. First, I'd like to thank Mr. Crossman and his team for providing their expertise through this audit. As you heard, the audit is essentially an addendum to the initial audit conducted on PEB's information technology systems, for which the committee heard the 6-month follow-up during the earlier agenda item. And as indicated in our response, PEB accepts all 4 findings associated with the supplemental audit. Although PEB has developed a corrective action plan, which is due to be presented to the PEB board later on this month, we have already taken steps to rectify some of those security concerns identified in the report. As you heard from Ms. Bingham, several of those concerns are regarding security risks related to the agency's antiquated systems and servers, not unique to PEB, unfortunately. This is just part of what we deal with in state government. But we have replaced or decommissioned all those obsolete servers. PEB IT staff have also been in close coordination with EATS to ensure that the updates to the agency policies and procedures are appropriately addressed and that the security concerns are resolved and or the security concerns identified are resolved. Similar to the steps that were taken in the first part of this audit, PEB will also be taking appropriate measures to better track and monitor ongoing maintenance and administration to ensure appropriate IT oversight is being performed. So with that, I would be happy to take any questions from the committee.
Any questions for the agency committee members? Okay, seeing none. Thank you so much for your comments, Ms. Rich, and I will go ahead and accept a motion to approve the report.
So moved, Madam Chair.
Motion from Assemblywoman Carlton, second from Senator Brooks. Thank you so much. And Mr. Crossman, will you call the roll?
Senator Brooks,
Yes.
Senator Goycochea,
Yes.
Assemblywoman Carlton,
Yes.
Vice Chair Benitez Thompson.
Yes. Motion passes. We can go ahead and move on at this time to Department of Business and Industry, Office of the Nevada Attorney for Injured Workers. And we have our Deputy Legislative Auditor, Yuri Ikovlev, and Sandra McGurk. And it's all yours.
All right. Good morning, Madam Vice Chair and members of the subcommittee. For the record, my name is Yuri Yakovlev, Deputy Legislative Auditor. And as previously stated, I'm here to present our audit of the Office of the Nevada Attorney for Injured Workers, which I'll refer to as NAIW going forward. On pages 1 and 2, we provide background information on NAIW. This information includes the main services offered, a description of the workers' compensation litigation system in Nevada, case statistics, and a summary of revenue and expenditures. Towards the bottom of page 2, you will find our objective was to determine whether NAIW had adequate controls over information systems, performance measures, sensitive information, and case management timeliness. The scope of our audit focused on NAIW's activities for the period of July 2018 to December 2019. Our audit findings start on page 4. We found information systems administration needs improved monitoring to ensure the continuation of critical services. At the bottom of page 4, you'll see that NAIW was not timely in renewing its service level agreement for IT services with its vendor, and continued to operate for 9 months without an agreement in place. The vendor continued to provide services without payment during this period, but NAIW was at risk as there was no guarantee that servers were being properly backed up by the vendor. Continuing to page 5, we found that NAIW has not been reviewing user accounts that have access to NAIW's critical systems. For example, we found 2 active accounts for former employees that had not been disabled and removed. In addition, there was an active generic administrative account for an outside agency that provided administrative access to NAIW's servers. We determined this account did not need to be active. On page 6, we note that NAIW does not comply with state security standards as they do not verify the adequacy of their server backups and have not requested backup testing results from their IT vendor in the past. In addition, NAIW does not have a written IT contingency plan, so they cannot guarantee that services and operations will continue in a timely manner if IT functions are ever compromised. Towards the bottom of page 6, you'll see that background checks were not conducted on the IT vendor's employees. And at the top of page 7, NAIW was not aware of its responsibility to ensure employees of the IT vendor completed required annual security awareness training. Moving on to the middle of page 7, we note that controls over calculating, documenting, and reviewing performance measures are deficient. Specifically, we could not substantiate the accuracy of measures reported in the governor's executive budget. Exhibit 2 at the top of page 8 displays our testing of these measures. In summary, 4 measures did not have any supporting documentation, while the remaining 4 did not always show how NAIW calculated the reported amounts. The supporting documentation did not always agree to the reported amounts, and there was no evidence of any managerial review. The issues noted during our testing can be attributed to a lack of comprehensive policies and procedures. At the bottom of page 9 through the top of page 10, we note that performance measure usefulness can be improved by emphasizing outcome-based performance measures. These are recommended as they better demonstrate an agency's impact on Nevada, including how effective the agency is in providing services. On page 10, we found that NAIW does not adequately secure clients' personally identifiable information, such as social security numbers and medical records. The personal information is stored in unlocked file cabinets during non-business hours where the non-state employed janitorial crews have access. 7 recommendations are listed on pages 11 and 12 to improve administrative controls over the information systems, performance measures, and the security of sensitive information. On pages 13 through 14, we found that case management administration was adequate in ensuring the timeliness of cases. Through our testing, we found that case processes were generally timely, with NAIW sending and requesting necessary documents and information in a timely manner. However, the need for evidence and information from third-party sources delayed some cases, as NAIW does not have control over the timeliness of receiving said evidence and information from those sources. A description of our audit procedures starts on page 15 in Appendix A. NAIW's response to our audit is located in Appendix B on page 19. And on page 25, we note that NAIW accepted all 7 of our recommendations. That concludes my presentation, and I'm happy to answer questions if you have any. Thank you.
I appreciate that. Members of the subcommittee, any questions for Mr. Yakovlev? I see none. Perfect. And I believe we have someone from the Office of Nevada Attorney of Injured Workers. If you have comments that you'd like to put onto the record, you're welcome to do so.
Good morning, Madam Chair. My name is Evan Beavers. I'm Service Nevada Attorney for Injured Workers, and I'm here on behalf of the agency this morning. I'd like to begin by thanking Mr. Crossman and his staff for taking the time to understand what we do and how we do it. And I accept their recommendations. There are shortcomings that I should have addressed earlier. I'm grateful that they would point those out. Of those 7 recommendations, I think 4 we've probably already completed, 3 we're in the process of completing, and I anticipate that in short order we'll be able to comply with all of the recommendations. Thank you, Madam Chair.
Thank you. I appreciate that. In the world of these type of audits and some of the findings and recommendations that we get back, this one was overall pretty, I thought, did
Well, thank
better
you.
than some
Good
of
to
the
hear.
ones I've seen come back, which we, can't even make public for a while. So
Thank you for making that comment.
any questions for Mr. Beavers from the subcommittee members? Nope. Okay, seeing none, thank you so much for your time.
Thank you, Madam Chair.
I'll go ahead and accept a motion to approve the report.
So moved, Madam Chair.
Thank you, Assemblywoman Carlton. A second from Mr. Gokachia. Thank you, Senator Gokachia. And Mr. Crossman, I'll let you call roll.
Senator Brooks,
Yes.
Senator Goycochea,
Yes.
Assemblywoman Carlton,
Yes.
Vice Chair Benitez Thompson.
Yes, and the motion passes. All right, we're on our second to last one. We're going to move on to the report on the count of money and the state treasury. Always one of my favorite ones to, have publicly release an account for every single penny. So Mr. Crossman, I'll let you.
Thank you, Vice Chair. For the record, Dan Crossman, Legislative Auditor. The count of money in the state treasury is required by NRS 353-060 and must be performed annually by our office. This project involves a detailed process that includes reviewing reports from the state treasurer, sending account balance confirmations to about 60 financial institutions, and reviewing various financial reconciliations. The culmination of this work is this report you have before you today. We filed the report as required with the Secretary of State's office on December 21st of 2020, at which point it did become a public record. However, we are required to present the report to the subcommittee as well for your acceptance. The team that works on this is with us today in the event there are some questions. However, generally there are not, but we will allow that to be your decision. So with that, I would ask for your acceptance of the money count report.
Any questions from members of the subcommittee for Mr. Crossman on this report? All right, seeing none, I will go ahead and accept a motion to approve the report.
So moved, Madam Chair.
Thank you so much. A motion by Assemblywoman Carlton, second from Senator Brooks. Thank you so much. Mr. Crossman, I will let you call roll.
Senator Brooks.
Yes.
Senator Goycochea.
Yes.
Assemblywoman Carlton. Assemblywoman Carlton. Okay,
Yes.
I see a thumbs up. Vice Chair Benitez Thompson.
Yes. Thank you so much. We have motion passes. All right, so we will go into our last audit, governmental and private facilities for children inspections. And Mr. Crossman, I will let you take us into this.
Thank you, Madam Vice Chair. For the record, Dan Crossman, Legislative Auditor. One of our roles is to review governmental and private facilities for children on an ongoing basis and provide information to assist with legislative oversight. Ultimately, our goal is to help ensure adequate protection of children in these facilities. As you'll see in this report, we've continued our efforts to perform inspections on more facilities with greater frequency. I'll now turn the presentation over to Sandra McGurk, Audit Supervisor, to provide an overview of the result of our recent inspections. Ms. McGurk.
Good morning, Madam Chair, members of the subcommittee. For the record, my name is Sandra McGurk, Audit Supervisor. I am here to present our Governmental and Private Facilities for Children Inspections Report. Our work was conducted pursuant to the provisions of NRS 218G.570 through 218G.595, which requires us to determine if the facilities adequately protect the health, safety, and welfare of the facilities and whether the facilities respect the civil and other rights of the children in their care. On pages 1 through 4, we discuss background information and the type of work we completed. We completed inspections of 15 children's facilities, which we refer to as unannounced site visits in our prior reports. 7 surveys of children's facilities were also conducted in response to the COVID-19 pandemic and related restrictions, during which we did not perform on-site physical observations. In 12 of the 15 children's facilities inspected, we did not note anything that caused us to question the health, safety, welfare, or protection of the rights of the children. However, on pages 5 through 7, we discuss Kiddos Nevada, a specialized foster care home which was licensed by Washoe County Human Services Agency. At Kiddos Nevada, we observed several issues that prompted us to question whether the facility adequately protected the children in its care. Some of the significant issues observed at the home included overflowing garbage, the filthy bathroom, beds without sheets, piles of children's clothing in disarray on the floors, behind doors, and in bins, and a pile of children's clothing on the garage floor. In addition, one child's bedroom smelled of human waste. We determined the home did not meet minimum foster care standards established in statutes. Following our visit to the home, we contacted Washoe County to discuss our concerns. Subsequent to our discussion, Washoe County confirmed that all of the children residing in the home at the time of our visit were moved to other facilities, and Kiddos Nevada management closed this home. Continuing on pages 7 through 9, we discussed Three Angels Care, a foster care agency that is licensed by Washoe County Human Services Agency. At one of the 2 foster homes operated by Three Angels Care that we inspected, we observed several issues that prompted us to question whether the facility adequately protected the children in its care. Some of the significant issues observed at the home included children's clothing lay in piles throughout the home, including the laundry room, making it difficult to decipher clean from dirty laundry. The children's bedrooms were in disarray with clothing on the floor, in laundry baskets, and bins alongside trash. And the kitchen floor was sticky. In addition, we observed an unsecured pair of scissors in a child's bedroom, maintenance equipment on a shed roof, and broken furniture and unsecured shovels outside of the home. We determined agency management did not ensure its foster parents met minimum foster care standards established in statutes. Following our visit to the home, we contacted Washoe County. Washoe County moved the children in the home to other placements and issued a corrective action plan to the foster parents in the home. In addition, Washoe County issued a corrective action plan to agency management, instructed Three Angels Care to attend training, and notified the agency that its homes would be subject to monthly visits. Continuing on pages 9 through 10, we discuss Specialized Alternatives for Family and Youth of Nevada Incorporated, which I will refer to as SAFI. SAFI is a foster care agency that is licensed by Clark County Department of Family Services. At one of the 3 SAFI foster care homes that we inspected, we observed several issues. These issues included several areas of the home that were dirty. The children's bathroom had clothes, a towel, and trash on the floor, and the kitchen had dishes covering the entire countertop and dirty cookware on the stove. We determined agency management did not ensure its foster parents met minimum foster care standards established in statutes. Following our visit to the home, we contacted Clark County to discuss our concerns. Clark County issued a required action plan to SAFI and its foster parents. In addition, Clark County instructed SAFI to submit photographic evidence of the home for a period of 6 months and identify options to prevent foster parent burnout. On page 11, we discuss surveys of 7 children's facilities. We did not note anything that caused us to question the health, safety, welfare, or protection of the rights of the children in any of the 7 facilities surveyed. Our conclusions were limited by the health and safety restrictions associated with the COVID-19 pandemic, which has had a significant impact on our work. Specifically, we did not physically observe the conditions of the facilities surveyed to determine if the facilities met minimum standards established in statutes. Appendix A on page 12 contains a list of the inspections and surveys we completed. Appendix B on pages 13 through 15 provides some background, population, and staffing information on 61 children's facilities in Nevada. That concludes my presentation. I would be happy to answer any questions the subcommittee may have.
Thank you so much. Questions from subcommittee members for Ms. McGurk on the audit information? Ms. McGurk, I do have a couple questions, and it's just to help me put some things into context. So 12 facilities doing well, good. 3 facilities not doing well. 2 of those facilities licensed in Washoe County, 1 in Clark County. Do you know, or do we ask in the course of the audit for verification of the last time the county had individuals in the home, either social workers or a licensing worker? Is that something that is known to us when we do these audits?
For the record, Sandra McGurk, it really depends on the information we get back from the licensing agency. I do know that 1 facility in Washoe County, their workers were in that home that same week. The entity in Las Vegas, I do not know when the last time a worker was in that home, but I believe there are representatives from the agencies that could maybe provide some additional information.
Okay, thank you so much. And then I'll ask that I do have a follow-up question, which is coming from page 9, and I now know I will direct that to the agencies, and it's just the it looks like part of the corrective action for Angels Care is that the agency would inspect the homes and do monthly visits, but I'm pretty sure monthly visits in some fashion or form are already required because there are foster children placed there. So I will have that question for them as to how that is an enhancement for protections when that actually seems to be, I would think, the absolute minimum. If you could talk a little bit more again, Ms. Skirk, so the way that the audit committee has been doing and audit staff has been doing these kind of inspections for quite a while, quite a long time. And every time we go out to do these audits, there are always findings. And I guess the hope would be that the trend would be over time, less findings of poor health and welfare in these homes in which we are housing our foster children, and then children in the private facilities. Does it seem to be that over time we're seeing a change in the quality of these, the private facilities?
For the record, Sandra McGurk, audit supervisor. It really depends. You have to look at the different types. Like if we look at foster care homes, we have to look at all of those together in order to determine if the quality is improving. We have to look at those separately than the other licensing type of entities, such as childcare institutions and facilities. I think it's very difficult to give you an answer. I do believe that the licensing agencies, Washoe and Clark, are doing a better job of going to the homes, which in turn will help us down the road. I know that the licensing agencies have been very responsive to what we've brought to their attention. They have been very transparent in the information that we ask for. It's just, these are difficult issues to observe and bring to the forefront, but I think it's needed. And I think if we all continue to collaborate together, I think we can all work to eliminate these issues. I'm sorry, I can't give you a more clear answer than that.
No, I appreciate that. And I imagine that's something that we can go back, because we've been collecting data for a while by licensing type. So we could actually look and see by licensing type where we seem to be making progress and where we perhaps are, you know, they seem to be stale in their level of progress. But also really happy to hear that there's going to be more frequent eyes and ears from our auditors checking in across these facilities. That gives me great confidence that we'll be able to see more things and catch them before perhaps they get too much of a problem or things get too dirty or too unsafe for the kids in the homes. I don't believe I have any other questions from members. So at this time, I'll go ahead and invite agency representatives up. I see we've got Ms. Miller, Mr. Armstrong, and a couple others.
Yes, good morning, Madam Chair. Ross Armstrong from the Division of Child and Family Services. As Ms. McGurk noted, the facilities that are highlighted in the report are licensed by Washoe and Clark County, while DCFS is the licensing entity in the rurals. And so I think there's representation from those licensing entities. On the line, I see Deputy Director Paoli on
Yes.
from Washoe at least. And so we have folks on standby if there's general questions, but we aren't the licensing entity for these three.
Off the hook this time, Mr. Ross, right?
Yeah, in case I and in case I don't have the opportunity again, I just want to thank Ms. McGurk and her team. I think, Madam Chair, you pointed out the trajectory overall has been good and improvement for facilities and children, and we consider Ms. McGurk and her team key partners in improving the outcomes for kids across the state.
Appreciate that. So Ms. Paoli from Washoe County, I believe that you are available and on the line. And so the question that I had, and then I will ask it again of Ms. Sandvik I'm sorry, we have Ms. Yes, we have, I'll ask it again of Clark County if we have a Clark County person available, but just for Ms. Sandvik or Ms. Paoli from Washoe County, I guess, for some of the homes, there recently had been personnel from the county in there. So do we have a better way of gauging, you know, where they might not have seen deficiencies that our auditors had?
Thank you for the question, Vice Chair Benitez Thompson. This is Amy Sandvik, coordinator for Washoe County Human Services Agency. To answer your question, we have case workers assigned to the children in the home going out there on a monthly basis, and licensing workers don't have that same requirement. And so for the particular home that Ms. McGurk mentioned, workers had been in the home, it wasn't the licensing worker that was in the home. There were other staff within the agency that were there. And so that's one thing we took note of and are working more collaboratively within the agency to make sure that we are in better communication on the licensing side with the caseworkers or clinical staff or other support staff that are in the homes.
I appreciate that. So when we have the note in here that the agencies, that Washoe County Human Service Agency has notified the agency that there would be monthly visits, those will be by the licensing team then, not just the social worker caseworkers for the children. It'll be that specific licensing purview.
Correct. And so we, on the licensing side, especially when there's a corrective action plan in place for this particular circumstance, we were doing weekly, on the licensing side, weekly home visits prior to COVID occurring, and then doing virtual weekly inspections as well. So we have increased the frequency of the licensing entity visiting the home.
I appreciate that. And I imagine that it can be hard to do unannounced visits virtually. Are they all scheduled, or have you found a manner where licensing can still kind of in an unannounced way kind of pop in to take a look around and see if in, you know, at any given moment of time, if standards are being kept up?
We are doing unannounced virtual visits as well. It's a little more challenging, of course, than being able to just knock on a door, but we still are accomplishing that successfully.
Okay, I appreciate that so much. Any other comments that you want to put onto the record at this time?
No, thank you.
All right, thank you so much. And then I don't think I have someone from Clark County to answer the same question in regards to the facility that they license. We have the comment in here coming on page 10 that they're requiring photographic evidence from the home for a period of 6 months. And I'm just interested in what that frequency is, of whether it's monthly and or whether there are, like Washoe County seems to be doing unannounced virtual visits at this time, but I don't know if we have someone present to answer that. And if not, then I'll just go ahead and send out the request for that information in writing and make sure that it gets back to the committee members. So, Mr. Crossman, I don't see anyone. Is that correct from Clark County?
Vice Chair Benitez Thompson, correct.
Right.
If you'd like us to ask those questions of the Clark County and get back to the committee, we can do that.
Yes, please and thank you.
Okay.
Okay. Any other questions from subcommittee members? All right. I did have one last question, and this is for Mrs. McGurk. We had 3 different homes. The total for the 2 homes that had to be closed, how do you know the total number of children that were in those homes?
Yes. For the Kiddos Nevada, there were 5 youth in the home at the time.
5 kids.
Ranging between, excuse me, I apologize, I misled you. There were 4 kids living in the home at that time, ages 13 through 17. For the 3 Angels Care home, there were 6 youths living in the home at the time we did our inspection, ages 6 through 13.
All right, so we had 6 and 4, so 10, or did I hear you say another number and then say an aggregate of 13?
No, in kiddos, 4 kids.
Yeah.
There were 6 kids. And in the Safety home, there was 1 child.
1, okay, all right, perfect. So 11 of those kiddos now in safe homes. Thanks for your work, I appreciate that. I'll go ahead and accept a motion to accept the report.
So moved, Madam Chair.
Thank you, Assemblywoman Carlton, and a second from?
Second.
Thank you so much, Senator Brooks. And Mr. Crossman, I will invite you to call roll.
Senator Brooks?
Yes.
Senator Goycochea?
Yes.
Assemblywoman Carlton?
Yes.
Vice Chair Benitez Thompson?
Yes, motion passes. Right, at this point, we're now at agenda item 8, public comment. And so we'll ask our broadcasting staff to patch through any public comment if we have members who would like to address us.
Chair, the public line is open and working. There are no callers at this time, but would you like to take a 2-minute break to allow people watching online to call in?
Yeah, let's give it just 2 minutes.
Okay. Chair, the public line is open and working, and there are no callers at this time.
All right, in that case, I will go ahead and move to agenda item 9, which is to adjourn. Thank you, members and department heads and staff for being with us today. And we will see you all at our next meeting. Gavel.